welcome to this launch webinar of the NHS England Clinical Entrepreneur Programme Patient Entrepreneur Pilot that we are running. So first of all, I'll start just by introducing myself, and then some of the people you're going to be hearing from this evening. I'll outline what we're going to be covering this evening, and there's going to be time for plenty of questions throughout. Now on Zoom, I'd ask you to remain muted while you're here, and if you want to ask a question, please raise your hand, or you can type something in the chat box and we'll come around to you. But there is going to be a whole section at the end that we've left about half an hour for questions and answers. So, but I'm also happy for you to raise your hand in the intervening time. I think there is a mute button as well that we'll occasionally deploy if accidentally, someone leaves their mic on. We did have a clinical entrepreneur once who went down the gym and didn't realize he'd left his camera and his mic on. And so in front of a large audience, he did his whole gym routine. But fortunately we were on Zoom, so we could mute that for a bit, but he kept turning it back on without realizing it. So no, it was entertaining, but we won't do that. So look, let's start with introductions. So my name is Tony Young. I am a practicing consultant surgeon at Southend Hospital. I'm here in Southend in Essex now. I am Associate Medical Director for Innovation and Transformation and Research across Mid and South Essex, which is the 10th largest foundation trust in the country. We look after about 1.2 million people, have a turnover of about £2 billion. And I lead all the digital transformation from a clinical perspective for our outpatients too. At Anglia Ruskin University, who are the commissioned host of the Clinical Entrepreneur Programme. I'm the Chair and Director of Innovation and Entrepreneurship, partly because when I was a junior doctor, I dared to dream that I could change patient care through not just being a doctor, but by building taking amazing ideas, turning them into businesses and building great companies. Boy, I didn't know how hard that was, but I had to go 4 times at it, raised £5 million, exited them all. Some broke me and the bank, and others allowed me to make my money back. But I learned a lot of lessons along the way. But I had to fight the NHS my whole way as an entrepreneur. And we've changed that narrative now, and we'll talk about that. Because actually some of the latest, greatest things are coming out of the startup world and are coming out of entrepreneurship. And we're missing a trick in improving quality of care and patient experience if we don't learn from that world and we don't embrace it. And before this program, we weren't doing that. So anyway, and then at NHS England, I'm the National Clinical Lead for Innovation. So I sit in the Innovation Research and Life Science team. We've got a couple of my colleagues here from that team this evening. As well joining us, and our remit there is really to try and make the NHS a go-to place for healthcare and life science innovation, getting the latest, greatest innovations that will change and transform patient care and pathways taken up in the system. It's not easy, it's not all going to be done tomorrow. It's kind of why I love the job, because no one else would take it on, and it's not easy. But we put patients at the heart of everything we do. And around 8 years ago now, I've been in post a couple of years at that point. So Bruce Keogh, the National Medical Director, said, Tony, we're losing some of our brightest talent from the NHS. They're going to the commercial world. They're joining tech companies and startups and other things. How can we retain them here in the NHS? How can we keep that talent? Even if it's only for a while, it will benefit the National Health Service. It will benefit our system. There'll be great leaders potentially in our system at some point, and we need to learn from them. So long story short, we designed the Clinical Entrepreneur Programme, which has gone on to become the world's largest entrepreneurial workforce development programme in healthcare and life science. To date, we've had about 1,100 clinical entrepreneurs come through the programme. Between them, they've started up over 500 now life science companies. They've over 130 million patients and professionals have benefited from their innovations. And between them, they've raised over $1 billion. Who would have thought that the workforce on the front line of the NHS if you empower our greatest asset, which is our workforce, then look what you can do. However, since year one, I have been every single year, and I thought they were going to sack me some years, but I thought, oh, well, at least you've sacked me because I've done the right thing. I said, we have to have patience at the heart of everything we do. We say that as a system. I want them on the entrepreneur program. Please, can we open this up? Because only by including everyone and having that lived experience of the journey, either as a carer or as a patient. I mean, I know I'm a urological surgeon. I know how to take your kidney out, your bladder out, your prostate if you have one. I'm pretty good at that. But have I been a patient on an inpatient ward having, well, I have had one, but, you know, have I got lots of lived experience as a patient? Very little. Okay, I see it from a, but so only by getting everyone involved who's involved in the care system will we do that. So in year one, I was allowed to bring in junior doctors. In year two, it was expanded to all doctors, and I think nurses and allied health practitioners, I think. And then slowly, year three, year four, we expanded it to all professional groups. And I think year four, year five, we were allowed all NHS employees. And then I did something, oh, my boss is on the line, I have to be a bit careful. I did something that I was told I wasn't allowed to. I snuck a patient onto the program as a patient entrepreneur. I thought, are they going to sack me? And he'd been a mentor on our program. He's going to be speaking to you. Seb, he's here in the top row of my screen a bit later this evening, tell you a little bit about his journey and some of the things he's learned. And I thought, oh, it really worked. And we had some great feedback from Seb. We were doing everything right, and we change and we learn and we grow. We really respond to feedback in what we're doing. So so this year we teamed up, and you're going to meet my colleagues from the patient involvement team at NHS England, who are going to tell you a little bit about their team and the work they do, and about how we're going to support you, because we have to do something a little bit different when we're bringing patients on board to this. And they said, we think it's a great idea. Let's try it. Let's test it. So we're going to look to bring hopefully 10 patients onto the program this year. Now we've got a whole evening, so Polly's told me I'm allowed to speak for 15 minutes. I've got 4 left. I've used that most of my time. So we're going to run through this evening with you a little bit of the nuts and bolts of the program and what you can expect, a little bit about the support you can expect from us, some journeys of people who've been on the program to hear from them directly. You'll hear from Polly, our program manager. So Polly, do you just want to wave and say hello? So this is like Celebrity Squares. For those of you who are really old, you'll know what that is. So Polly waves, that's Polly in Celebrity Squares. And then we've got Seb, who's one of our patient entrepreneurs. Do you want to say hello? Say, look, who was it who used to have, oh, Bob Monkhouse. Oh, he's long dead, isn't he? Right, and then we've got Tamsin, who's joining us, who's my co-clinical. Honestly, it is a bit like one of those shows, isn't it? And then we've got Alice and Sophie, do you want to wave, from our patient involvement team, who are going to be joining us as well. Oh, look, and there's Christine Farrow, my deputy director. Hello, Chris. There we are. Everyone, so friendly bunch, this lot of NHS England, I don't know. So what we're going to do is we will, the entrepreneur program essentially offers you a commercial coach and mentor to help you grow. It's not about supporting startups. It's about supporting you as an individual to gain commercial skills, knowledge, and experience to improve healthcare. Okay, so it's not a startup accelerator or support program. Great companies do come out of it, and great things that change patient care, and you're going to hear some examples of that. But the fundamental thing is about supporting and developing the human beings. That's what the NHS does with this. And that's why we're different and have been super successful in what we do. So commercial coaches and mentors, we have over 250 of those, a whole load of educational days, 9 of them across the year. We call them pit stops, where you will learn all about the NHS and how to sell into it. You'll learn all the theory around lean business, startup, legal and regulatory, branding and marketing, understanding yourself as an individual and your personality type, your team, how to build a team, how to be a leader, how to coach them, selling into the world when you get successful, understanding digital health and technology and AI, fundraising, all the things you need to know. Now, some of them will be really new to you and you won't be familiar with them. Some of them you might think that's quite advanced, but it's only, we don't do really deep dives into all of it. We have a whole load of resources of a fantastic digital learning environment, our hub, which you will get access to, which has a whole range of pre-recorded webinars and events and other things, but also a range of live events that you can join and ask Q&As on particular areas and subjects that you may be struggling. So commercial coach and mentor, lots of educational days, supporting you in testing, trialing and adopting and scaling your innovation largely through something called our Insights program, short for Innovation Sites. 10 NHS organisations across the country who don't get a lot of funding, but if we can make the case that what you're doing is really important, and we've got to persuade them, we've got to make them fall in love with it, we can help get that taken up, test and trial. We're hoping to expand that and then perhaps even double the number of those organisations, so perhaps 17 or 20 of them coming on later this year. So a real opportunity to test and trial at scale. We know where we haven't got any money to give you. I wish I had. We don't. I've been asking for it for a long time. Christina, I've been asking for it for a long time. I haven't got any money yet. But what we do know is we know where all the pots of money are buried. So we know how to help write grants, or whether it's Innovate UK or other things. We know where the funders and investors are. We know the sorts of things they invest in. And so we can help advise you and pull it together. And that's how people have been successful in raising so much money. We do a number of industry days as well. Some of them are shortly. We're going to be at Be Brawn in about a month's time, visiting one of the largest medical device manufacturers in the UK, and we're going to be out visiting their headquarters in Sheffield in early December. But we've been to some of them are pharma companies, some of them are tech companies. IBM, we spend a day with them normally each year learning about some of the really advanced tech that they're taking forward. Not all of it is relevant to everyone, but it just opens your eyes to the art of what's possible out there and gives you an idea. There's nothing like this anywhere else in the world, and we could only do it in the National Health Service because this is the largest provider of health, single provider of healthcare on the planet, and it has the largest workforce, 1.4 million people. Who knew? They were quite entrepreneurial. And when you release them, you're going to hear some of the stories, some world-leading technology that is changing lives across our planet has come out of this program. And that's what inspires me and keeps me going day in, day out. And we have achieved before patients. We did manage to achieve something else that I'm super proud of. I'm not sure any of them are here this evening, but we teamed up with Crisis, the homeless charity, and they have a grant program run through something called their Venture Studios, where they give £5,000 to people who've experienced homelessness to help them start a business. But they didn't get coaching and mentoring and an education program. So we partnered with them a couple of years ago now. And for the last 2 years, we've had 4 of the Venture Studios entrepreneurs from Crisis. And do you know that when you've been homeless, you can suffer some of the worst health inequalities there have been. You don't get access to all sorts of things. And it's been a real revelation having them on the program. It's been really wonderful. So I am super excited. From day one, I've wanted to have patients included on the program. And I am so thrilled that my colleagues, Sophie and Alice from NHS England, in our patient and public involvement bit of our organisation said, we'll back you, let's do it. And that's why you're here on this webinar this evening. Could this be the start of something really wonderful? I think so. I really, really think so. I hope so. So we're asking you to come on this journey with us. We don't know what this is going to look like at the end. We've run the program. This is going to be year 8 you'll be joining of the program. So we know what that looks like. We're going to have to put extra things in place to support patients. You know, doctors and dentists and nurses and allied health practitioners, pharmacists, clinical scientists, other NHS staff. They've had some training in this space, but patients will come from all different backgrounds and experiences. So we're going to have to personalize the kind of support we put in place. So you're going to have to be patient. You're going to have to be proactive and come with us on this journey, because if this works, I think some truly wonderful things will come out of it. I recall Michael Series, who was, I think he was the 6th or 7th total bowel transplant patient in the country. And forgive me being a little bit medical, but I've done lots of stomas, which are where you take a piece of your bowel and you bring it out to a bag on your tummy as a surgeon. I've done that a lot. Never once have I thought about the consequences of when that fills up and explodes and leaks when you're in a restaurant. But that had happened to Michael, or even worse, when you were trying to have intimate relations with your partner. And it was just, so he developed this little device that would go over the bag and tell you when it was half full. And it would just set an alarm and alert on your mobile phone so that you could be alerted to changing it. Sadly, Michael died a few years ago, but he kept going to me, Tony, when are you going to let patients on the program? So I can't tell you. This is just a wonderful, wonderful moment for me. We should have done it at the start, but you know, it wouldn't have been right because we needed to get the program right. We're there now. So I'm so thrilled to have you here with us. I really, really am. I think this is the start of something amazing. Now, I've overspoken and I need to leave time for questions. So I think, Polly, next on the agenda is Sophie and Alice. Is that right? Polly runs the show here, so she'll tell me what I'm doing.
It is. There is a video. Do you want me to start with a video though?
Oh, yeah. Do you want? So we've got a little. Yeah. So we've got one of our clinical entrepreneurs is a doctor, but he's a patient as well. And why don't you play? How long's his video?
It's only a couple of minutes.
2 minutes, and this is Rupi Ojla, who you may have seen him. He's the Doctor's Kitchen are his cookbooks, and here he is, and he's been on TV, done programs with Prue Leith, and he's just recorded a little video for us on his journey. So when you're ready, Polly.
Hey, it's Rupi here. I was asked by Lucy and Prof. Tony to do a quick intro to myself, the clinical entrepreneurship program, and how that's helped me for the launch of the patient entrepreneurship program, which I think is a wonderful, wonderful initiative to engage more people in not just their entrepreneurial activities, but actually bringing to the forefront solutions that would have otherwise been missed by clinicians and anyone else working within the NHS structure and healthcare in general. So, a bit about my story. I'm Dr. Rupi. I've been an NHS doctor for 15 years now, working in general practice, A&E. I've worked abroad in Australia, but largely in the NHS in London, Brighton, and some other areas whilst I was training. And my first experience of what ultimately led me to start the Doctor's Kitchen, which is a platform where we talk about nutritional medicine using the evidence base available to us and trying to empower people to eat well every day. This sort of all came about as a result of my experience becoming a patient. So back in 2009, I started suffering from atrial fibrillation.
Not sure what happened there. I'll just read it a bit.
Hey, it's
right. Sorry, there's a problem with that file. Which
Okay.
webinar.
Well, it always happens. Don't worry, Polly. At least everyone knows it's live.
Let me just. I've got a separate version of this that I downloaded yesterday. So
well, should we look at it later and let's crack on, Polly, and we can start it at that point. You can timber with the AV in the background,
and we'll share it with everyone after anyway.
We can, and Rupi tells you about his journey of developing atrial fibrillation and how he managed to correct that through nutrition and his diet. And so that experience of becoming a patient, a young man in his 20s, being offered an invasive cardiac procedure, which is an ablation, which is where we burn part of your heart, and it scared him, really, even though he was a doctor. And he managed to change it through nutrition and sorted himself out. So, but hopefully we'll get that a bit later. So now I am going to hand over to my colleagues, Sophie and Alice, who are going to tell you a little bit about how we're going to bring patients into the clinical entrepreneur program and support you. Over to you.
Thanks, Tony, and thanks for a very inspiring intro there, because it's, as always, you're a hard act to follow. I just want to, we've got some slides, so I just want to introduce you to the team, the patient and public involvement team who will be working on this programme. But also, just to start with, it is really exciting. I'm so pleased that we've managed to join forces and make this happen, because we see in the work that we do every day, patients, carers, family members, all with fantastic ideas, all with kind of really solid experience of using healthcare services, identifying where improvements could be made, but even more important, kind of really spotting where there could be real transformations in patient care, patient experience, and health outcomes, that just through the daily experience that they're going through, and then kind of people taking that one step forward and going, do you know what, I've got a solution to this. I know how to kind of do something like build an app or a device, or there are amazing ideas coming forward, and over the years we've spoken to many patients who've come forward and said, I've got this great idea, I don't really know where to take it, and certainly the NHS, I think, has been a bit fragmented around how do we direct people to the right space to really kind of get their idea moving. So it's really exciting to be starting something new here. Polly, could you move us on a slide, I think? Keep going. So just a quick hello from us. I'm Alice. We've got Sophie with us tonight, who'll be speaking a little about the programme. And then we've got Julian Lewis, who isn't here today, who also works on the programme. And if you scoot us on. And I've probably already said a little bit about this already, but some of the reasons that we really want to make sure that we're getting patient entrepreneurs, patient innovators involved in this programme is we know that people with a first-hand understanding of the condition really understand unmet need in a really different way. And we know that bringing involving people in the innovation pathway, that whole thing from what's needed to how do we address this, to what's the design of how we address this, to testing that, and then thinking about how we scale that and get that out to lots of patients across the front line. Involving patients and carers in the whole spectrum of that is really important. But for us, it was really about kind of making sure, how do we bring people into the heart of this program, because I think we've got so much wasted opportunity without you being involved. And then the other thing that we really had an eye on is, we know that patient communities and networks really have a very strong understanding as well of where there are maybe access inequalities or health inequalities around health outcomes and patient experience. So again, really wanted to kind of make sure that we were really listening to that element of the work, and thinking about how we can really address that through this program as well. So if we scoot us on. People who've worked with me will know that I use this slide a lot, and I really like it, because it when we work with innovators, people who work in the industry quite often know what's needed and what's worked, but without actually involving service users, we don't maybe always get it quite right. So the mobile on the left works perfectly well, but it could be better, because from a user perspective, we're just looking at a load of cuddly bottoms there. And I think for me, it is really about, if we start with people's lived experience and then we build on that, and in this program really support people to bring their ideas and grow their ideas for what the real solutions are, that then hopefully we're bringing kind of real better outcomes and real transformation for patients. So if I scoot us on a little bit. So we're going to talk a bit about the programme throughout this session, and Tony's already talked a bit about the content of the programme. It's a 12-month programme. We're building this particular element of the programme on the Successful Clinical Entrepreneurs programme. They're moving into cohort 8. There has been a lot of testing, refining, and building the programme through those previous 7 cohorts. And so I think we're in a really good position to be joining the programme as it is, in a really strong place with all of those business connections, all of those kind of mentorship networks that Tony was talking about before, all of those industry connections. They've been building those up over many years now. So it's a fantastic time for us to be bringing in and testing a patient entrepreneur program. So what we want to do is we want to develop a targeted cohort specifically for patient innovators or people with lived experience. So by patient innovators, we're really including anybody with lived experience of a particular condition, including family members or carers. So everybody's welcome to apply for the program. We're offering the same package of support that you would get as a clinical entrepreneur, which is really rich and really well thought through. So all of that educational content, the commercial and skill development, the access to coaches and mentors, really kind of, focused work on a range of different topics, and then access to those kind of industry days, an alumni network, the resource hub. So all of that will be available because we will run the pilot just as a clinical entrepreneurs program, but we're going to add some extra elements to that, recognizing that patient entrepreneurs and patient innovators might need some additional support or also additional learning and development opportunities. So key aims, I think, for us over the next 12 months is we really want to prove that this works, because if we can prove that this works, we can build it into the program as a whole going forward. But more than that, we also want to test out what's needed. So we think we've got a really rich program with the clinical entrepreneurs, and we know we need some additional support. And we've identified some areas where we think we can put some things in place. But you might tell us as you go through this program, actually, we could really do with some extra stuff on a particular bit of learning content or some educational structured resources, or we don't know what that might be, so we're definitely going to be learning together around this. So we will all be walking through the same program at the same time, and identifying kind of areas that really work and areas that we can strengthen going forward. So key things that will be additional to the program, so additional to the regular kind of 9 pit stops and some of those kind of industry days and things like that, we'll be offering regular support meetings with a really small group of our patient innovators, so that we can kind of link up together and do some peer sharing and learning. We're looking at some additional educational and training resources. Some of those are around the basics of the NHS, so understanding funding flows and commissioning and how different aspects of the NHS fit together. Because if you are a patient, it's not always obvious. I'll be honest, if you're a member of staff, it's not always obvious either, because then the NHS is a real super tanker. But we've identified a number of different training and resources that we think will be really useful around some of that kind of getting to know the NHS element. The other thing that we're looking at is specific coaching and support around how you use your personal experience, which is the thing that has driven your innovation, but in a way that protects your psychological safety. And I think that's really important, because one of the things that I'm acutely aware of is people with lived experience live this in their daily lives, in some cases forever. And as clinicians in the clinical entrepreneur program, or as other NHS staff, there's an opportunity to say, do you know what, actually, this is really impacting my well-being, or this is too much at the minute. I need to just walk away from this for a bit. And while, of course, there's an opportunity to sort of pause work on an innovation, there's not that opportunity to walk away from your condition. So that there's something about making sure that we support you both to be well in around your health and well-being, and kind of being mindful of the needs of you as individuals, but also to kind of manage how you talk about your lived experience impacting your and influencing your innovation, because talking about that all the time can be really exhausting. And then the other thing that we really want to do is make sure that we're really linking up with patient advocacy organisations that are relevant to either your lived experience or your specific innovation in health tech or digital the space or whatever it might be, so that we link you up with like-minded people who are also networking with other patients or can bring some knowledge and insight to the programme. Do you want to move us on a slide? Little bit about the application information. Sophie, do you want to pick this slide up?
Yeah, sure, Alice. So all of the information can be found on the website. So there is a portal to apply. We do advise to look at that information early because it is quite detailed. It does mirror the Clinical Entrepreneur Programme application process. And there is a 1-minute video pitch, which again, is really exciting and really useful for us to see, the reasons behind your innovation, what led you through your lived experiences to develop that. So do take time to look through the materials on the website. There's previous webinars as well, and put time into thinking about the pitch. There's also frequently asked questions on there, and obviously you can contact ourselves or the Clinical Entrepreneur Programme team, and obviously be happy to help or guide you. I think we've said sort of everything. We're so excited, as Alice and Tony have both said, to be finally launching this and opening it up to patient entrepreneurs. People have maybe asked, well, what do we class as a patient entrepreneur? And we're keeping that definition quite broad. So anybody who has developed an innovation as part of their lived experience, so either directly as a patient or perhaps as a carer or a family member. And we've also said that it needs to be in development. So there needs to be, some sort of bones to the idea, that it's not just a concept, it's moved past that, perhaps with some market research or that's being developed. But obviously the programme will help take that to the next level through that mentorship, through that support, through the face-to-face and online events. And then our team, as Alice said, is really there for that wraparound support as a patient entrepreneur, and to really bring together the cohort as peers as well. So there is that opportunity to obviously share with the peers who are also other patient entrepreneurs on the programme. So the application is live, it is open, do share far and wide. Closing date 27th of November at 5 p.m. And the programme will be due to start with the Clinical Entrepreneurs Programme in March next year. So do look at the information early, do take that time, and do contact us if you have any questions or queries. So that's it from our part. So yeah, absolutely delighted to be launching this programme, and I'd like to introduce Seb, who is, as Tony said, a patient entrepreneur who's been on the programme, and Seb is going to share a little bit about his journey, what led him for his innovation, and a little bit more about the programme. So over to you, Seb.
Thank you, Sophie. Hello, everybody. Let me just share my screen. Can everyone see that okay? You see some thumbs up, good. So yeah, welcome everyone. I'm Seb, and I'm the co-founder of Ivy Relief, and I just wanted to sort of share with you my kind of journey setting that up, my journey and struggles, I suppose, being a patient entrepreneur, and my experiences of the Clinical Entrepreneur Programme this year, and really excited to see that it's now like properly being opened up to patients, and look forward to seeing more people on it. My sort of entrepreneurial journey started when I was at university in Birmingham. I was studying chemical engineering, but didn't really like chemical engineering. Ended up getting involved in a few different projects, and then ultimately ended up setting up my own web design and marketing company, and went on to run that after I left university. So I kind of started in the sort of business space. Not that long after I left university, I was then ended up with severe diarrhea and bleeding, and my health really declined, and I was diagnosed with something called ulcerative colitis, which is a form of inflammatory bowel disease. I was 21 at the time, and like I had no idea what to expect, and it like completely changed my life. And yeah, I just remember just not knowing anything that was going on, what was going to happen to me, how I was going to live with this. I kind of just hoped that I'd take some medications and be better, but very kind of quickly learned that it's not that straightforward. And then a big turning point for me is I joined a Facebook group where I started to meet other patients with inflammatory bowel disease and started to learn from their experiences. And that really kind of changed my health, because it kind of made me sort of think, oh, okay, I can play a role here. And the more I learn about my condition, the better I can kind of then live with it and improve my quality of life. What I did start to see was, here's some examples from the Facebook group. There were so many people with questions in these Facebook groups, like thousands and thousands of people in these groups sharing all these questions and concerns. And it really struck me as to like, why are people having to turn to these Facebook groups and ask these questions? Like, surely they're kind of healthcare teams, or they should be able to get that information or understand that kind of stuff. But there's also lots of like really quite deeper questions that are coming out as well. Things like how to actually live with the condition. Like this patient was facing surgery to probably have their bowel removed, and they were completely like overwhelmed by that. And there's just, when you're as a patient, you realize like how much, like there's so many different aspects to it. And I say to people now, like, you almost need like a degree living with a condition. You need to learn so many different things. What sort of struck me was the information that I was given as a patient was pretty dull and boring. I'm sure lots of people have come across this kind of stuff. And it kind of made me sort of think like, we must be able to do this differently. We must be able to do this better. Like, why are we given these pretty boring, non-engaging kind of handouts to try and guide you through pretty anxiety-inducing, life-changing kind of things? So I had this kind of idea. I was like, I want to change that, or try and help change that. Could we like create videos? Could we create websites? Could we do lots of different things? Coming from sort of a digital background, it was like, I knew there were so many different and better ways of engaging people and educating people. Like, why aren't we using those in the NHS? And I'm a pretty optimistic person. I was like, oh, we can just do it. Like, it'll be fine. But what I soon sort of came to realize was, when I was trying to then engage with the NHS or engage with healthcare teams or try and get things off the ground, I just kept going round and round in circles. I'd kind of go and see, I don't know, someone, they would say, oh, go and speak to your CCG. And then they're like, oh, go and see an AHSN. And I'm like, I don't even know what these things are. And then you go and try and talk to these people, and then you get passed back around and you end up doing full circle. I remember meeting Tony at the NHS Expo, and that was about 8 years ago now. And that was for the launch of the Clinical Entrepreneur Program. And it was like, oh, wow, this program looks like amazing. Like, I'd love to be on this. Like, Tony, can I be on it? And it was like, no, sorry, you're not doctor. And it's like, oh, okay. And I've been bugging him every year ever since. And it just, again, it's been quite a sort of frustrating and lonely journey, I suppose, as a patient entrepreneur, because every time I try and do something, I wasn't necessarily taken seriously. It's like, oh, you're a patient, what do you kind of know? And I really genuinely believed I had something that was gonna make a difference to patients. I was then a few years ago really fortunate to meet a team at Addenbrooke's Hospital in Cambridge. At the pediatric IBD team there, and they really engaged with sort of the ideas that I was suggesting, and they were like, we want to help you. So what we did, we sort of sat down as a team and assessed all the information that was being given to patients. So the leaflets, the handouts, whatever. We then worked with the patients and families to kind of assess all that information and kind of work out what was missing, what was good, what was bad. And what came out of it was, especially the younger people, they're like, we want videos, we want more engaging ways of engaging with content, and covering lots and lots of different topics beyond just sort of medical stuff. It might be like how to live with it, how to deal with school and things like that. We then turned those into courses, and then we ended up developing what we now call IBD Mate, which is a online educational platform where we can educate patients about all different aspects of inflammatory bowel disease. It's now like one of the biggest video libraries in the world for IBD, and we've also built in different tools and resources to help patients with their journey. And what we're seeing already is it's helping reduce the number of helpline calls. It's making patients less anxious about different things, and just like making a big difference to those patients and also the teams. We've also got some plans at the moment where we're introducing symptom tracking and also looking to connect people together as well to provide peer support. But all of that sort of came from working closely with this centre that bought into my idea. And I mean, this is sort of a success story, I suppose, at the moment, but we've also worked with the team to create this kind of prescription as well. So they wanted to be able to provide education to their patients that was relevant to them. So now this is actually being used by the team where they prescribe education to their patients that's relevant to that particular part of their journey. And we're now working with a number of different hospitals in the UK to deliver that education, and we're also working on adult care as well. We've also been fortunate to work with a number of organisations as well. This all might kind of look impressive, but it's taken me a hell of a long time and lots of different things to get there. And so many times I've thought about giving up and not sure like how to sort of where to go next, how to do it. And even now I'm still, there's lots of challenges of like, how do you make this sustainable? How do you make it scale? And saw someone in the messages sort of like the always ongoing question of how do you scale these things? And then this year was really fortunate to be accepted onto the Clinical Entrepreneur Programme. I managed to sneak in, I think, through, I'm now officially a volunteer for Addenbrooke's Hospital. So I'm like technically part of the NHS now. And it's been super helpful so far. Like, I think like being in a sort of an environment with other people that are going through those challenges, connecting you with like different people. I've had a really good mentor that's helped me kind of develop my ideas and kind of sort of think about how I'm approaching things. But it's still like it is intimidating as well, like coming at it as a patient. Like the first kind of pit stops I went to, it's sort of like, I'm not a doctor and I'm not, it's like people are like, oh, what do you like, where do you work or what you do? And I'm like, well, I'm just a patient. I'm not a doctor and those kind of things. And I definitely have had sort of imposter syndrome around that, but over sort of the months, it's given me a lot more confidence to sort of go, actually, okay, I'm not a doctor, but I've had, I don't know, different experiences, certainly from a healthcare point of view, but also I've learned other things along the way, and I've advanced things in different ways. So yeah, it's been super helpful so far. I'm really looking forward to sort of seeing how it's going to develop over time as well, because I think it's not just a 1-year program. It's sort of something that I'm going to engage with for a long time, and I've already met like some amazing people and made some good friends as well. And super excited to sort of see how this now develops to encourage more patients, because all along I've always been like, why is there not something like this? How can we help patients with this? Because we've got such good ideas of how we can help the health service, and we just need that kind of support to develop them and get them into use and kind of help patients. That was a quick run through of my journey, but I'm happy to answer more questions at the end as well.
Thanks, Seb, so much. Look, we'll move really quickly on to my co-clinical lead on the programme, Tamsin Holland-Brand, who's also a paediatrician who has got her own wonderful journey and really patient-focused and inspired innovation. Tamsin.
Oh, thank you, Tony. And I just want to say to Seb, we all, because I also started my journey as an NHS worker who applied to this programme as a clinical entrepreneur, and that feeling of that, you know, everybody, the room is full of amazing people. I understand that feeling, Seb, and we have many different professionals. And so there's this, the programme is so rich for that. So patients will be incredibly valued as part of that enormous multidisciplinary team, because the collaboration and the networking between all of us is so strong, and it helps everybody's innovation. So everybody is individually valued because of what they bring and the perspective that they bring from. And we're so lucky because we have nurses, physios, doctors, surgeons, people in admin. And so that mix is what makes it so wonderful. I'm just going to share my screen, which sometimes kicks me out, so you can't see me, but that might be a better thing. And I'm a paediatrician, so I work as a paediatrician. But I'm also a mum. So what I was focused on, interestingly, was I was doing all of my paediatric clinics and seeing children for a variety of different things. But I was also asked to take a clinic once a week looking at children with hearing loss. And actually what I started being able to see was that there were children who had the most common type of hearing loss, which is where kids get really blocked up with a cough or a cold, and then they get fluid and mucus building up behind their ears. So basically they get really congested. You know what it's like when you get a cough or a cold yourself and you get really blocked up. And so it was, children get this and their anatomy is very small, and it means that it's difficult for them to hear. And the problem is that if you leave children for long periods of time, which we do leave children for periods of time, because the reason being that we wait and see if it self-resolves, if it gets better on its own. But actually what I was seeing is that these kids that got this repetitively, they ended up being the children that I was starting to see in my other paediatric clinics. So the kids with a bit of hearing loss would turn up with, oh, maybe they've got speech and language difficulties, or maybe they've got learning difficulties or education difficulties. And so I started worrying that these kids, their development needed them to have hearing earlier, and that being left with hearing loss, a little bit of hearing loss for long periods of time, was interfering with their development. Sorry, Tony, you're on my screen. And the current practice, I don't know if you've heard of grommet operations, but if it's a really persistent problem, then it's possible for people to have a grommet operation, which is where you put the child to sleep, and then you make a little cut in their eardrum and put a tiny little tube across the eardrum and help that fluid drain out and help them to hear a bit. Now, they could potentially have a behind the ear hearing aid, but because that fluid that sits behind their eardrum kind of comes and goes a bit, that actually it's quite difficult to match the hearing loss with a hearing aid. And I don't know if it's a numbers game, but 1 in 10 kids who start school have this condition. And we know that from all of the schools that have hearing screens in the first year of school. And they often have hearing and vision screens. So we know that. So I have 5 children, and one of my children had this condition. And so she started off getting lots of ear infections, and then she wouldn't turn round if you called her name, look a bit blank. She would stand very close to the television set. her sister would read a book this close to her ears. And actually, it turns out that even if all your mates work in the NHS, it still takes a long time to get a grommet operation. So it took my kid 1 year from diagnosing her as deaf, or her first hitting the NHS because of being deaf. It still took her a year to get a grommet operation, which is pretty impressive for everybody working flat out, because you need to see 5 different people before you get to the grommet operation bit. And it changed how I was thinking about this, because before I thought there was a problem, and I thought perhaps we should do something. And at this point, when I had watched her trajectory slow from struggling to learn how to read or mishearing words, that I knew that we could do something better, that people were seeing someone in the NHS, but then going away for 3 to 6 months. And that was the problem, that they were going away and having nothing else to do at home, and then just waiting for that one clinical encounter. So initially, all I wanted to do was do a research study on these particular type of hearing aids. Now, they work, you look a little bit like an 80s tennis player, but they work by sending sound, taking that sound, turning it into a vibration, and sending the vibration across the bones of the skull into the inner hearing, which happens to be in the bone. So it'll just, it doesn't matter how much fluid is behind your eardrum. It will just send it round directly to the inner hearing, as long as your inner hearing is working well, which it normally is in children. So I was told not to do that study, because those type of hearing aids are £3,000 each, and that the NHS just couldn't afford it for that many children, and that parents couldn't afford it. So I went to a little electronics store and asked, this is actually a small little tiny transducer, just 1 centimetre big, and asked how much it is. So this is just the transducer that takes sound and turns it into a vibration. And it turns out that costs a tenner, and that you can build your own one for approximately £12, which is pretty hopeless, because it's got loads of wires everywhere that'll strangle a child. But you can make your own one for about £12.99. And then, to cut a very long story short, I ended up looking at these, which were emerging onto the market 8 years ago when I started, but you've probably seen them now, which is where you see cyclists and runners wearing these, and it hooks over their ears. And I was wondering, if these cost around £100, maybe we could use these. And that if we were able to use these, there were 2 ways that we could use them. Potentially, we could help children to hear by pairing them to a little microphone that the teacher could wear in the classroom. That's the first photograph there. Or potentially, we could pair them instead to a computer or a phone and give speech and language therapy, or listening skills, and help children to not fall behind in their development. And so a long time later, it took a long time to get to the point where we've got a headset that's been developed to have lots of safety features on it. And there's an app which helps children to not fall behind in their development. It's also got a little home hearing screen on it, so that you can monitor your child at home between appointments, and a little headset for the child to hear, and a microphone for the teacher or the parent to wear if they're struggling to hear. And the app has got lots of features on it, but it's also a medical device and kept very safe. And also included now in something called the NICE guidance, which is the National Institute for Care and Health Excellence, which is the guidance that healthcare professionals should follow. And actually, I had the opportunity to take these to a low-income country, because the ones that we made are in the £50 region. And as you can see, that they got used incredibly well. And even if they had slightly broken them by accident, they were repairing them and using them for years. And that was in Malawi. We did that little study, and now we have patients doing little videos for us in Chichewa, which is the local language, to help people understand how to use these, because they don't need an audiologist, and mean that people can use them remotely, even if they are nowhere near a hospital and won't be able to have access to a hospital. Again, like Seb, I've got a lovely page of awards. It really doesn't represent the number of times I sat on the stairs wondering whether to give up or not. But wonderful to have the opportunity to speak to you all. And I feel particularly privileged to be part of the team.
Amazing. Thank you, Tamsin. So let's move on quickly. I think Polly, Polly, in the interest of time, we won't play Ruthie's video. We can send everyone the link. You were just going to run through some of the nuts and bolts, I think, of the application process. Is that right? Here we are. Look at that.
Just some slides here. Sorry, my cat
So
decided to join.
when you go on a webinar with Polly, there are a range of different animals that can join us. You'll find as we go across it.
Right, so just to reiterate what Alice and Sophie said, applications are open. They close on the 25th of November. We'll assess them during December and January. You'll be notified early January, late January, early February, and the programme starts officially on the 6th of March. There's lots of resources and videos that you can access on our website. The link is here, nhscep.com/PEP. There's lots of resources. There's an access to the form there too. So I'd go on there and just have a look. And these are just some tips. Read the FAQs, check you're eligible, use a valid email address, keep your answers concise. Please complete all sections because we won't consider them unless you've completed all sections, and don't forget to do your video pitch. That's it.
That was very quick, Polly. Brilliant. Okay. Well, look, I'm bang on time. You got us bang back on time. Look at that. Perfect. So look, we're going to hand over to you if you've got any questions. A few people have been making some comments in the chat. I'm not very good at double tasking, so I don't know if there have been any specific questions. But if you have any, you can either just raise your digital hand or just open your mic up, to be honest. We're all friends here. You can do that. Someone has just said, I saw that pop up in the chat. It was, is there an interview? I'm sure I saw that somewhere.
Yeah.
And the answer is no. In year one, we did interview people and they all came to Tobacco Doc, to a startup that was an accelerator that was supporting. It was quite exciting. And some of them we interviewed at NHS England too. And in year two, we did it. But the program just got so big. We're interviewing hundreds of people is a logistical nightmare. And actually, we switched then to a complete digital assessment, which is why we do the 1-minute video pitches, because don't try and do anything, just do it on your phone. Just be you. And we want your passion and your kind of why you're doing this to come across. It's always great to say who you are and what you do. You can talk about the problem, you can talk about the solution you've come up with, you can talk about why you want to join the program. I think there are quite a few examples on the CEP website that you can look at of those things, but it's just don't be overly worried about it. It gives us a real idea of who you are. It brings a digital form to life. There's a real human being attached with this. And I love it. So don't be apprehensive or worried about it. They're not shared publicly at all. Just with the team of assessors who look at them. Although I do have to admit, some of our entrepreneurs who pitched in year one, I have asked their permission because they're now really successful. Can I show? It's like what's that video program of when they were before they were famous or something? I don't know what it is. Anyway, and you show it, and it's quite funny to see what they pitched when they first came on the program and where they are 7 years later. And it's like it's quite fascinating to see that. But we wouldn't do that without anyone's permission. It's great. Tamsin, we should have showed yours from your first hit. I never had to pitch to get on the program because I designed the program. I can't remember. I seem to recall it was pretty good. But there we are.
I don't think anyone expects you to be good yet, do they? When they
no, we're not expecting. We teach you how to pitch on the program. We want to see where you are. Any more questions coming up? Polly, can you help me?
Someone's just asked how many places are available, but Sophie has answered that. Do you want to mention about IP or?
Yeah, we can talk about that. So with regards to places, this is the pilot, and we're planning to, fund 10. What would happen if 10,000 patients applied? Well, the PPI team would have a big issue, wouldn't they? Would have to go to the boss of NHS England and say, patients have overwhelmed this. They really want this. What do we want to do? So those are our plans and what we're starting with. Oh, look, so before I go on to IP, and NHS England doesn't own any of your IP, that's the simple answer. We're not claiming it. Lisa's popped her hand up. Hello, Lisa.
Hi, I'm Lisa Beaumont. I had a quick question. It was for Seb, really, which
Sure.
was, has Seb considered rolling out his solution across different conditions? So
It's a great question. It's a great question.
It's a communication solution, really, that he's come up with, and it can apply to any condition for people and relevant age groups and so on.
Yeah, thank you for that question. It's definitely something that we would like to do. My biggest challenge, which we're still working on, is how we make it sustainable, and how it is funded. Because at the moment in the NHS, education isn't really funded, not properly anyway. So it's kind of, if I had a magic wand, I'd love to just do it and roll it out everywhere and do it for every disease I could. But it needs to be developed and those kind of things. But hopefully we'll get there one day, or we can partner with people to help make it happen. For me, it's always been about how do we help patients, and if other people can help do that, then that would be great.
Okay, thank you, Lisa. Seb, someone else is popular this evening. Someone else has popped a question in the chat for you. Alex, I think it was earlier. I missed it earlier in the chat. If when you started your innovation journey, you had 3 wishes, what would they be? And what 3 things would you have done differently? I think he's asking, where did you mess up? So what would you have had to start with? What wishes would you have had? And where did it all go wrong? And we're good on that on the program, don't you think so? We do. It's a safe space to talk about when we've had negative results, and you learn from other people's honesty about when they had a disaster and it didn't work.
I think things that I would do differently, like I've had so many different challenges and mistakes and all kinds of things I'd love to do very differently. I think for me, things I would do differently, I think step 1, I'd probably get a job or something in the healthcare space to allow me to have a stable income while I can still learn on the job as well. Because my biggest frustration for years was I was still running a web design company, so I was still having to do stupid client websites and things like that, where it was I really wanted to work on what I was doing, but I couldn't because I was being drawn off to do other things. So I think trying to get some kind of way of having an income but working in the space so I can learn and that kind of stuff, I think I'd probably do that. I think I would trust my instincts on things a bit more. And I still struggle with this, I get distracted easily, or you'll have hundreds, thousands of people giving you advice. You should do this, you should do this, you should go and talk to this person, you should go and do this. And it's taking me down lots of different routes that I've learned a lot from them, but it's probably taken me away from what I probably should have been doing. So I think having a much clearer focus of okay, this is what I'm doing, and actually kind of do some stuff. I think I probably also simplify things. So trying to get an innovation into healthcare, and it doesn't even have to necessarily be in the NHS, is a massive task. And I think I came into it quite naive and kind of we just do this and it will work and this will happen, but it's not that easy. I think I would kind of try and think, can I make something small successful? So can I get something up and running, get that working, learn from that, then go to the next step, rather than like, not that I didn't want to think big, but like start small, get something successful, get something working, and then sort of move to the next step. I think those are probably my biggest takeaways from what I've learned. Well, there's going to be hundreds of things I've learned.
Oh, that's great, Seb.
Well,
Thank
really.
you. I think lots of the entrepreneurs do what you've done, which is bootstrap their innovation to start with, so they carry on working. We encourage them. We don't want everyone quitting their NHS job thinking they're going to go be Silicon Valley billionaires, because most of them aren't going to be, but they will learn a lot that will make them a better leader, better at introducing innovation, better at changing patient pathways and care. So that's really important. But we've got, I can't read the text box and do hands up, so I'm going to go to hands up now. So Kim, you've got your hand up first in the little queue there. Good evening. What did you want to ask?
How will this programme help me cross the chasm, in the sense that NHS is great at innovation. It's bloody awful at implementation.
So you would expect me, as the national lead for innovation, to give you a little bit of pushback on that. I get where you're coming from, but you know, I don't work in the private sector. I just work in the National Health Service. I'm totally committed to improving patient care, and so much so that I've decided to, you know, like a vocation, devote my career to saying, I've been given a great privilege. I'm a doctor. My education was actually free. I trained so long ago. And I want to do something to improve the system, to make it better. And believe you me, there are lots of great examples I could give you. And I know we've got lots of absolute car crashes on the way in how we've done it too. But I mentioned earlier, we've developed something called our Insights programme. At the moment, 10 NHS trusts across the country, who NHS England give £200,000 a year to each, not to pay for innovations, because that wouldn't pay for very much, but to pay for the staff, to give the organisation the capacity and the capability to get started. So they get an executive lead, a managerial lead, a clinical lead, and then a full-time programme manager and some support staff. And we bring them together in a network. And so far in the first year, I think we put about 50 of the innovations that were ready to be tested, trialed, adopted and scaled from the entrepreneur programme onto this framework. So this kind of marketplace, if you like, where they could pick them from. And 12 of the innovations have been procured and had contracts in the first year, and another 19 are going through the process at the moment. So this is a brand new thing. No one's tried this anywhere in the world. So we have, and this year, NHS, so many cuts. You heard recently the government, the NHS had asked for another £1 billion to cover strike costs and other things, and that was declined. And so many things are being cut, but actually the Insights programme is being expanded. So NHS England does think this is really important. So we do have a mechanism for overcut. It's not all done. We've got a long way to go, but working together, we will learn how we best do it. I think the staff have got to be trained and educated to how to do it. They've got to understand they have permission to do it. And so the blessing of NHS England is important. But you know, with patients, how great to have patients alongside us with their great ideas and innovations. We're going to be an unstoppable force. What chief executive of an NHS organisation is going to turn around to a patient and say, sorry, we're not taking this thing that radically improves patient care up? No. I can't see it, can you? But let's try it. Let's see what we can do. I haven't got all the answers. It's not going to be all done tomorrow, but we'll get there. Good.
Good answer.
Thank you. Thank you for your question, Tim. So Chris Fernandez is next. Chris.
Hey, thanks for the webinar. It was really good. I'm a patient founder and fit much of the criteria, I guess. Probably like many other founders here, spend weeks, hours trying to figure out how to work with the NHS. So it's really timely. And there's so much content out there, it's difficult to actually figure out where you're supposed to focus your time, really. I just had two questions, really, and it was about what is the model stage of startup or idea or business that you want to be applying? And the second one is about the criteria it's assessed against.
Okay. So in the first thing, where I can kind of take them both together, it's not a startup. We want human beings. I'm not appointing startups to the program. We want wonderful patients. We have wonderful NHS staff and clinicians. So you could just have an idea of how you want to improve it and have done nothing more than that. But on the application form, we ask you to use an example of either something you've done. It could be an innovation that you've wanted to take forward, a new idea, or it could have been something else you've been involved with if you haven't started that yet. The aim of the program is actually to transform patient care through innovation by learning commercial skills, knowledge, and experience from the startup and entrepreneurial world and bringing that to the benefit of patients. So you could already have a startup, you could have raised money. That's great. We've had people on the program that have done that. That's not the commonest thing, though. Very commonly, it's an idea, they've tested, they've trialed it, they've done some background research into it and looked into it, but are not sure how to take the next steps. And that's the reason they apply to the program. Have we had some people apply who've already raised £1 million and are building a great startup? Yes, we have. Have we had lots of people raise £1 million on the program? We've got this wonderful consultant nurse on the program, who Bernadette Porter, who used to have this saying, you don't have to raise £1 million to change 1 million lives. And then after 2 years on the program, she got a £1 million award from our SBRI healthcare program. And I said, Bernadette, you can't say that anymore because you've just raised £1 million. And she said, I'm a nurse. How have I done that? She was amazing. And she was just true to herself. So it's so be yourself, be inspiring. It can be very early stage to something that's already developed. Maybe you've tested and trialed it and it hasn't scaled. The other thing I would always see to people, I feel a bit, you're going to get honesty from me. People know that. Tamsin, well, and we're not good cop, bad cop, but we are, I will be honest and plain. I'll be polite always. Tamsin's nearly lovely, always lovely to everyone. I don't know how you do it, Tamsin, but you will, too many people pat you on the back and say wonderful, and not enough people say there are these risks with this, and this is why this is not developing. How are we going to mitigate those? So we'll be very honest. So just be open, just be honest. It can be any stage of thing. And as for the application form, there are a whole range of different things on the website. And we've almost written the pro forma answer there for you, because this is not a test of can you guess what's in our mind, and it's not who can score the highest percentage either. We have a special little way we mark, which is wonderful. I love it so much. Don't know why other places don't do it. What we do is we look at where you are and where you've started from, and we look at where you've got to. So say you're starting at 0 and you get to 50%. Well, if the pass mark was 60%, you're never going to get on the program. But if you started at 55% and kind of your application indicates you got to 65, that's only a 10% improvement on where you were. So actually the person who's gone from 0 to 50 is going to make it over the line. So what we try and do is we equalize it by saying, it doesn't matter what your background is. Maybe you're a medical doctor with a PhD who's way ahead of the track on writing scientific papers and application forms. But maybe actually you're someone who works in maybe it's a manual job, but actually you've been really affected by something and you can't do your work anymore. And I've got one patient who's had a problem with his knee, couldn't do his heavy lifting and all the things, and he's developed a little exercising thing for his knee. It's a really great little idea. So it's the application form, all the explanations are on the website. I won't go through it now, but if you've got any questions, there's an email there and you can email the team. They'll only be too happy to help you. Chris, does that help?
Yeah, it was great. Thank you.
I look forward to seeing your application.
Yes.
Are you going to give us a clue what you do?
It's actually to do with knees. So
Ooh.
create a solution to help physiotherapy patients have better feedback outside of a clinic.
Oh, things like that I love. Sounds really good.
Yeah.
Sounds really good. So next up is Amy. She's got her hand up. Hi, Amy.
Hello. Hi. Thank you so much, everybody. It's really inspiring. Yeah, I've done lots and lots of lived experience work. So I really appreciate what people are saying about how to understand the NHS, and you go in with all your optimism, thinking, oh, we could just do this, we can just do that, and then discovering all those obstacles that Seb was talking about. And I was actually part of the workshop that before this webinar, we're talking about some of these things. And I did mention there the NHS England Peer Leadership Development Programme, which I would highly recommend to anybody who's a patient to do. It's a very straightforward FutureLearn, which is a digital platform course that you can do, which introduces you to so many of the way the NHS works, and it's a free course, and it just builds that understanding of how the NHS works, and you get to meet other people who are really interested in using their experience to help other patients. And then as part of that, you then become part of the peer leadership network, and spread ideas and things. It's just such a great tool to cross that bridge, as it were. So if you were thinking of going for the programme, then that would be something that you could do. There might be some crossover, of course, with this, but I know it's really useful. And just saying, Seb was talking about also getting a job, something that can provide income. Well, even if it wasn't a full-time job, just getting yourself immersed in any kind of lived experience work, found you find I've just found links here, there and everywhere. What am I interested in, what sort of organizations can I bring my lived experience to, and you will not only be able to use that lived experience to influence other people, but you'll learn about how systems work and get ideas and make connections and build people. So for the last 3 years I've been doing that. Some people say it's not work, but for me that's the way I get some income in, but that's not the primary reason for doing it. But that way I'm learning all the time about how to do it. So then if I were to do this program, for example, I think, well, actually I've got quite a wealth of knowledge, and also connections, and I call myself a lived experience facilitator because I like to help other people to do it, and so if you're going along that journey, rather than just thinking I'm a patient, I don't know anything, use your patient experience alongside what other skills you have. Like I put in the chat, patient is never just a patient. Seb's somebody who has a professional background in digital skills, which is incredibly useful, or other people, Tamsin's I'm a mum. Your skills as a mother are going to make you so useful in that area. I'm a professional musician by background, and I've been able to use that in my work, and also discover new skills that I didn't think I have, like strategic mind. I was like, where's that come from? But we've all got something we can offer, which we don't necessarily, we're not just a patient with our diagnosis. And also to remember that staff are also people who have experience of life too, because sometimes we can just think, oh, a staff's a clinician or an administrator, but everyone's been through something. And actually, if we realize that we're not two separate entities, but there's a crossover there, and that building relationships really does help. So we're not just experience and skills, but we're building bridges. And I think that bringing people together, making the links, is what we need to do. And this program's a great way to do that. But I just think doing things like the PLDP program is a great step forward. I know so many people who's like, I don't have any confidence to do anything like this, and they found the program so accessible, and it's just boosted them and given them so many skills to be able to, it's been a launch pad for so many things. So sorry, gone on a bit, but it is really a recommendation there.
Oh, thank you. No, Amy, that was very helpful. And I agree, it can seem daunting to people, and that's a great resource you've signposted people to. And we were really concerned about this when we started our partnership with Crisis, that we were going to be taking people who'd lived experience of homelessness
Mm.
and putting them to a room of NHS employees and
Yeah.
professionals, and it just wouldn't work. They are some of the most inspiring. You have to put your preconceptions behind you and go, they're remarkable human beings. They've been through what a journey. They've got a startup grant for a business, and now let's see where we can go. And they are some of the most inspiring, remarkable people I have met. So I can't wait for patients to join us, because
Yeah.
those stories, those individual journeys, but you're right, they're going to come at it from a different perspective, a different level of confidence and assurance with the program. And we're going to provide additional support for that. We won't get it all right to start with, and we go out for regular feedback and welcome that. And that's why I've said at the start, if you're going to come with us on this journey, it's going to be an experiment. But shouldn't we always have done this? Why have just doctors said we can design it and make the discoveries for everyone else? Actually, the doctors that listen, the doctors and the other clinicians that involve their patients, in my experience, have gained the insight and then found the way forward. And I think that's true through history. It's not just now. And we forget that at our detriment to the care we provide. So that was brilliant. Thank you, Amy, for what you said.
Sorry, can I just mention one thing? There is actually
You
another Future Learn course, which is working together with people and communities, and there's a whole feature on what they've done with homeless people in that course as well. And again, that it moved me to tears, really. It was extraordinary, and just hearing the reality of what they're going through.
Brilliant. Well, thank you so much, Amy. Right, I don't know, CP team, have there been any more questions? I cannot read the chat. I think people have been answering it in the chat. Are there any questions that are left unanswered, or does anyone have any other questions at all? Feel free. There are no silly questions, or don't feel that if you think there's something, someone else would have thought it too. But if you think of something later, go to the website. There's an email there. You can email the CEP team in the inbox, and we'll only be too happy to answer you privately and individually. There we are. Pod has put it up. cep@aru.ac.uk. Yes, Carl. Hello. Good evening.
Good evening. Thank you for this evening. It's been absolutely brilliant. I just wanted to ask. We're a company that have been started, and we're supporting a young lady who's had a stroke using virtual reality and helping with their recovery through interactive gameplay. And now we're looking to see whether we can support with some of the issues around recovering with their hands. So we believe in waiting well as well as one of our mottos. So we can be creating something to be supporting people to possibly take their own recovery into their own hands as such, and and working alongside. So I think the question I'm asking is, can you be a company? As I say, we're working with a young lady who is had a stroke, and we're developing something with her, for her.
I have an answer for you, but it's good and bad in one way. So you cannot be a company and apply to the program. We don't take imaginary. A company is just an imagined legal entity. It's not a real thing, like a human being. It's something that exists on paper. Maybe there are bricks and mortars, but that's a story for another day. But an individual working for a company who is a patient or a carer or someone with lived experience. So could you, as an individual, apply? Yes, you could. Are you providing care to someone through the technology you've developed? I'm looking at the patient team now. I think I've got that definition right, because you're providing care and support for an individual through that. This is not about...
That was exactly why we created it, to support.
Yeah, no, this is not about... It's not a company support program. There are programs that offer that. This is not that. This is about individuals.
This was for the young lady who's had the stroke.
Yeah, I think you're eligible. So I don't think there's a problem. But if you applied as a company, we would say no. We would reject that. You have to apply as a human being. That's what we want, human beings. Okay?
I'll try and fit into that category then.
Sure. Lisa, your hand's up again.
Yeah.
Oh, you've gone on mute, Lisa.
Hi, I'm Lisa Beaumont. I'm a patient representative in the field of neurology. And I coordinate a group of young stroke survivors in Kent. And one of the things that I've been really conscious of is how many times people are buying out of desperation. They end up buying devices online, and there's no registration process for accreditation for things that are sold online. And I want to talk to somebody about how to introduce a registration process for all medical devices that are sold online. And I don't know, I've been talking, I'm connected to Liz Ashell-Payne at Orca, because I know she does accreditation for health tech devices, because I work on one of those as well. But I'm really interested. I mean, it's orthotics is the issue for us, that my group is always being driven to buy orthotics from Amazon, which is crazy thing to have to do. And there's
Sure. So
people-
Lisa, that's a kind of question that's, I'm very happy to take it very quickly, but it's separate from applying for the entrepreneur program. It's a more general kind of interest thing, and this is a webinar about the program. But all medical devices are regulated by the MHRA, and anything that is sold in this country has to have UKCA or equivalent marking and meet the medical device regulations. And if they don't, they're breaking the law and they can be prosecuted. So there are lots of things that aren't medical devices that are sold widely to people for different, but that's another issue. But let me reassure you, the MHRA do regulate all that. And if someone crosses that line, it's a criminal offence, and you'd have to be a fool to do that, because as soon as you're found, they'll prosecute you. All right.
Brilliant.
Okay.
Thank you.
Thank you, Lisa. Right. Any more questions from anyone? Otherwise, I think we're there, and we're almost bang on time. Look at, we're bang on time, 7 o'clock. Unbelievable. I've never finished on time for anything in my life. Holly, do you want to say anything? Any last words?
No, but thank you everyone for joining us tonight. As I said earlier, check out the website cep.com/PEP, and all of the resources and details around about applications are on there. And
any fine sorry, Polly,
program, please just email us and we'll respond to you quickly.
And Alice, Sophie, Tamsin or Seb, any final words from either of you? You don't have to have, I'm just giving you an opportunity. Just good luck, everyone, with your applications, and we're here to help, I would say. Great. Okay, thank you very much, everyone. Have a good night. I look forward to seeing some amazing applications and welcoming our first patients onto the entrepreneur program. Good night.
Thanks, everyone. Bye.